Hi, I'm Anne-Marie Greetens, Director of Radiation Oncology at Baptist MD Anderson Cancer Center. I know coming in for radiation can be intimidating, and that's why the team and I wanted to share more about what to expect during your treatment process. The 5 steps of radiation therapy include consultation, simulation or setup, treatment planning, radiation delivery, and follow-up.
During consultation, you'll get to know your radiation oncologist and their team as they review details about your own situation and the therapy that is being recommended. By the end of the hour-long meeting, the hope is that you understand the suggested course of treatment, its potential benefits, and the possible side effects and risks. The team and I are committed to spending as much time with you as you need so that you feel comfortable proceeding with the recommended therapy.
We will review a lot of information during this visit, and it might be overwhelming. Bringing someone with you to provide emotional support and serve as another set of eyes and ears can be very helpful. At Baptist MD Anderson, we also have a nurse navigator program, which sets us apart from the other cancer centers in our area. Every one of our patients has a nurse navigator to answer your questions and help you move seamlessly from one part of your treatment to the next. You will have a disease-specific nurse navigator and one specialized in radiation oncology.
Every patient's radiation treatment is unique and tailored specifically to you. The goal of our team is to deliver the necessary radiation to treat your condition while impacting as little of the rest of your normal tissues as possible. Most radiation therapy is delivered through external beam radiotherapy, or EBRT. With this type of treatment, energy is focused into your tumor using a machine called a linear accelerator. Radiation is usually delivered in small daily doses over several weeks, but sometimes only one treatment is required. In order for the radiation to be delivered to the correct place, we must ensure you're positioned in the same way each treatment. To do this, we create a set of specialized devices to cradle your body in a similar position each day. These devices are made during your second visit to the clinic for what is called your setup or simulation. During this visit, a radiation therapist will create the devices that the doctor deems necessary to position you for daily treatment. Many times, temporary marks are placed onto your skin to help speed your setup when you return for therapy. At the end of this process, you will receive a tentative treatment start date.
The next step of the process takes place with you comfortably at home. Your doctor and their team of many behind-the-scenes colleagues, including dosimetrists and physicists, will create a specialized, unique plan to deliver radiation for you. Sometimes the planning process is completed in a few hours. Usually this is the work of several days to make sure the best possible treatment is created. Once your doctors are satisfied with your plan, we perform additional quality and safety checks. This includes reviewing your plan with our partner, MD Anderson Cancer Center in Houston, Texas. MD Anderson is consistently ranked as one of the top cancer centers in the nation. A panel of specialists from MD Anderson reviews your plan with our physicians to ensure the quality and care you receive here meets their exacting standards. Once your treatment plan is finished and approved, your therapy team will reach out to you to confirm your start date and time for your therapy.
When you arrive at Baptist MD Anderson, you'll head straight to radiation oncology and check in, just as you did on your day of consultation. You'll wait in the waiting area until one of our highly trained male or female radiation therapists calls you back.
You'll head to the changing rooms and place your belongings in a secure locker while the radiation therapists prepare the machine. You'll be escorted from the changing room to the treatment vault, where your treatment is delivered. Our therapists will assist you onto the treatment table, positioning you appropriately with the help of the devices created during your simulation. Next, the therapist will exit the room and treatment will begin. During this time, the therapist can see you and hear you, thanks to the cameras and microphones in the vault. Although alone in the room, you are never out of contact with our team. Music is played through the speakers in the vault to help you pass the time during your therapy.
Often, X-rays or CT scans are used during your treatment to ensure the radiation is hitting its target appropriately. The machine might also rotate and the table you're laying on might move to deliver all of the required therapy. Treatment typically takes 15 to 20 minutes.
You will feel no pain or discomfort during therapy. Once the treatment has been delivered, the therapist will re-enter the vault and assist you in getting off the table and out of the treatment devices. And you will return to the changing room and don your street clothes and regain your possessions. You will then exit the clinic on your own and return home. If your treatment lasts weeks, it is common to develop side effects such as fatigue, redness of the skin, or sometimes hair loss in your treated area. You will receive treatment Monday through Friday and continue to come daily until you have completed all of your sessions.
During the weeks of your therapy, your radiation oncologist will meet with you at least once a week to check in on your progress, answer additional questions that have occurred to you, and address any problems that have developed. This visit is called the on-treatment visit, or OTV. This visit will appear on your appointment schedule. Sometimes your progress might require that we change the plan. If so, we will discuss this with you. Please be courteous and on time for each appointment to avoid delaying other patients' visits. Also, it is best not to miss any treatments to make the treatments as effective as possible.